Hi everyone, my name is Clodagh Scannell. I am a registered dietitian and I work in the oncology unit in the Mercy University Hospital down in Cork. I'm also a PhD researcher and I work in the area of cancer and nutrition with the Clinical Nutrition and Oncology Research Group, which is based out of UCC. And today, on behalf of Clodagh, I'm here to present kind of an introduction to eating well with cancer. So I suppose cancer is not a one-size-fits-all, and I suppose just as a disclaimer, the advice in this video is just for a very general audience, and it should not displace or should not precede any information that you've been given by the oncology healthcare professionals that know you well. This is just a general guide. So this video, I suppose, is intended for people who have been diagnosed with cancer, who are going through active treatment, but have a good appetite, are not experiencing any symptoms of treatment that may be affecting their eating, have not lost weight or are not underweight from the offset. And I suppose if any of these are applicable for you, I would urge that you ask your oncology team to refer you to a dietitian. Dietitians are the only healthcare professional in Ireland that are able to diagnose, assess and treat nutritional issues in those who are vulnerable, who are unwell or who are sick. So the only healthcare professionals that deal with nutrition that are allowed work in a hospital setting. So I would urge you to get your advice from properly qualified individuals. So what the research says, that if, as I said, you have a good appetite, you're not losing weight, you haven't been experiencing any symptoms of treatment or cancer, that you should follow a healthy balanced diet while going through treatment. So eating a healthy balanced diet can make you feel better, it can help you cope with your treatment better, it can help you keep your energy, keep your strength up, it can also help to avoid muscle loss. It can help you cope better with side effects of treatment, reduce your risk of infection, and help you to recover faster. So just some statistics, studies have shown that between 50 to 80% of people who've been diagnosed with cancer lose weight at some point during their cancer journey, be that prior to diagnosis, at diagnosis, or because of the treatment. So maybe things are going really well now, but it would just be very important that you monitor your weight and you keep an eye on things and have it at the forefront of your mind. So preceding that then, kind of 4 in 10 report some muscle loss. And the studies show that if we lose muscle, sometimes we might not be as up to treatment. Our tolerance to treatment might be lower. We might be at increased risk of complications, and then we might just have a reduced quality of life. If our muscle is reduced, we might not be able to do our daily activities as well. So it's just something to be mindful of. I would urge you to monitor your weight. So you might go for your chemo maybe every 2 weeks, every 3 weeks, every 4 weeks. And when you go to the unit, the nurses might pop you on the scales and take your weight then. And if they do, that's great. But take a note of those figures, maybe write it down, put it in your phone, because it could be a different nurse the next time. They might not see the trend of you losing weight. They might not look back in your medical notes. So keeping a track of your weight is the best thing that you can do. If you don't get weighed in the unit, I would urge you maybe to get a scales, borrow a scales, or maybe get access to one maybe once a week or every 2 weeks, so that you can keep track of it yourself. So when you get up in the morning, light pair of clothing, after a bowel movement, after you've gone to the bathroom, that's probably the most accurate time to get your weight. And then you'll be really able to monitor and keep an eye on things yourself. And if you are losing weight, I would urge you to speak to your oncology team and get a referral to a dietitian. So I've said it before, so what is a healthy balanced diet? Well, a healthy balanced diet is something that incorporates kind of everything in moderation, is a phrase you might have heard before. So it's things like carbohydrates, your proteins, your fats, your minerals and vitamins, which you get from fruits and vegetables. So you want a diet that's really rich in nourishment so that you're better able to cope with your treatment. And it's really important that you don't skip meals. So you need to be eating either your 3 main meals a day, or if you find your 3 main meals difficult, maybe breaking that down into kind of 5 to 6 maybe smaller meals and snacks throughout the day. You want to be kind of replenishing your stores every 2 hours so that you're well equipped for treatment and for dealing with your cancer. So I suppose the nutrient that should really be at the forefront of your mind and something that you should put emphasis on is protein, because protein is the building blocks of our muscles. So as I said before, lots of people who've been diagnosed with cancer experience muscle loss. So if you keep your muscles topped up, that's a good way to kind of counteract this. So protein is found in things like meat, fish, poultry, eggs, cheese, dairy products. If you're a vegetarian, things like lentils, beans, peas and nuts. So when we're ill, when we're injured, when we're stressed maybe from treatment, our body actually needs more protein. So it's something that you should be trying to incorporate into every single meal that you have. This then is just a diagram, I suppose, of the Irish food pyramid, and this is available, if you haven't seen it before, on the Healthy Ireland website, and it's just a really good way to, I suppose, plan your day and to plan your meals. So everything that's, I suppose, down at the bottom is the things we need the most of, and the things that are up at the top are the things we need the least of. So we're aiming, if you can, for kind of 5 to 7 portions of fruits and vegetables a day, so that's where you're getting all your minerals and all your vitamins that can help you cope with treatment. Then the next shelf is the whole meal cereals, breads, pastas, rices. So we need 3 to 5 of these a day. So a portion is something like 2 potatoes or 2 slices of bread, maybe a handful of pasta, a handful of rice. And we need these foods because this is the kinds of food that give us energy. And then 3 to 5 depending on your age, your gender and your activity levels. The next one then is kind of the milk, cheese and yogurt shelf. So you're looking for kind of 3 portions of these a day. If you're going through treatment, I would recommend kind of the full fat varieties just for that extra nourishment. Then you're into your meat, your poultry, your fish, your eggs. And as I said, this should be kind of the thing that you really have a focus for. So trying to incorporate these into every single meal and snack if you can. Then lightly sparing your fats, your oils and your spreads. So these are things like your olive oil in cooking, your rapeseed oils, maybe things like butter, margarines, etc. And then the last shelf then is the things that kind of it's lifted up from the pyramid because we don't actually need it for good living. So it's things like your crisps, your biscuits, and all your kind of high foods, or your foods that are high in fat, sugar and salt. Then I've just incorporated in this diagram because I think it's a really nice visual, and I've taken this from the Canadians, and it's just basically how you would plan all your meals. So it's as I said, a really nice visual. So the half of what you're eating, be that a plate or your bowl or your lunch plate or whatever, should be fruits and vegetables. And then the other half should be broken down into 2 quarters. So 1 quarter being your protein source. So as I said, your eggs, your chicken, your fish, your meat. And then the other quarter then being your carbohydrate, which is your energy rich source. So there's your breads, your potatoes, your pastas and rice. And it's just a nice way to plan your meals. Just to touch then on alcohol. So I suppose alcohol is counterindicated while you're having chemotherapy. And that's just because I suppose it can make your symptoms, or it can make side effects of treatment worse. So it will dehydrate you, it can increase nausea, it can have issues, I suppose, with your bowels, and I suppose some people get kind of mucositis or sore mouth or dry mouth with treatment, so the alcohol is only going to make this worse. In terms of cancer prevention or cancer recurrence, I suppose there's no safe level of alcohol that is indicated for that. So you might have heard, I suppose, alcohol in moderation, but regards to cancer prevention and cancer recurrence, there's no safe level for this. So alcohol is best avoided if possible, and if you are drinking, I would urge you to speak to your oncology team about this and let them know. Just then to touch on physical activity. So there's a lot of emerging evidence at the moment that physical activity during cancer treatment is really beneficial. So exercise, I suppose, it's something that cannot be reproduced, the benefits of it. So you can't put the endorphins or the hormones that are reproduced into a tablet and take it. It's kind of something that's emerging now that it should be embedded into kind of best practice guidelines. So we should be recommending to all our patients and people who've been diagnosed with cancer that exercise is really beneficial for them. I spoke earlier about muscle loss and how that can negatively impact our treatment, and exercising can actually help to preserve that muscle loss. So exercise with a high protein diet is a great way to make you feel better and to improve your overall quality of life. With exercise then, it might sound counterintuitive, but it can actually reduce fatigue. So if you're feeling tired, you're not feeling up to eating, you're not feeling up to kind of your daily activities, a short burst of exercise that can only be 5 or 10 minutes of very gentle stroll can actually stimulate, I suppose, hormones and endorphins that will make you feel better and give you that kind of boost. Similarly, if you are, I suppose, going through treatment, you have a very poor appetite, a short walk outside or just taking in some air can help to stimulate your appetite as well. So I would encourage exercise in all my cancer patients, but speak to your oncology team, let them know that it's something that you're interested in, and then you can make a plan from there. So Myself and my team of dietitians down in University of College Cork, alongside our charity partner Breakthrough Cancer Research, have actually devised a range of resources for people who are going through treatment, people who have gotten the all clear, or maybe people who are looking to prevent cancer. So these are, I suppose, information resources that are all evidence-based, but also a lot of cookbooks that are also evidence-based and written by dietitians alongside a consultant medical oncologist. So if you're looking for more information about what I've spoken about, you can go on to Breakthrough Cancer Research, and all the resources are there for free.